Each year, over 480,000 Americans die from tobacco-related causes. That's 1 out of every 5 deaths that is attributed to tobacco use, which is more than car accidents, firearm-related incidents, illegal drug use, alcohol use, murder, and HIV and AIDS combined. Tobacco use kills up to 50% of its users. Because tobacco use harms nearly every organ of your body and affects your overall health, users are more likely to develop heart disease, stroke, and cancer. Tobacco use can cause cancer almost anywhere in your body and is the cause of about 90% of all lung cancer. Tobacco use has evolved over the years to include smokable and smokeless options. Smokable tobacco products include combustible cigarettes, cigars, hookah, and pipes. The smoke these products release contains 69 cancer-causing chemicals. Smokeless tobacco are things such as snuff, dip, chew, or snus. These items can cause tooth decay, recession of gums, and gum disease. Individuals who use smokeless tobacco are more prone to develop oral, pancreatic, and esophageal cancer. One of the newer, more popular tobacco products on the market is e-cigarettes, also known as vape pens, vaporizers, tanks, or electronic nicotine delivery systems, which is also known as ENDS. Studies show that vaping can weaken your immune system and damage blood vessels. Though the real dangers of tobacco use are widely known, people are continuing to smoke at steady rates and use tobacco products. In Tennessee, adults have continuously used tobacco products at a higher rate compared to adults in other states. But we're not talking about just adults. We're talking about youth as well. Products such as vapes and e-cigarettes have become increasingly popular for youth. These types of tobacco products are touted as safer tobacco products, but there is no safe tobacco product, especially for youth and young adults. Youth who vape are more likely to start smoking traditional cigarettes and using other tobacco products. In addition to the health implications of tobacco, using tobacco also has serious financial burdens. Tobacco users spend copious amounts of money on tobacco products, and the healthcare costs associated with tobacco use are higher than individuals who do not smoke. Tobacco use is considered a chronic disease. Secondhand and thirdhand smoke are also concerns surrounding tobacco use. Secondhand smoke, also referred to as environmental tobacco smoke, has 2 sources. Side stream smoke, which is the smoke that is from the lighted end of a cigarette pipe or cigar, and mainstream smoke, which is the smoke exhaled by a smoker. There is no risk-free level of exposure to secondhand smoke, and it is classified as a known human carcinogen. Secondhand smoke is a mixture of gases and particles that contains over 7,000 chemical compounds, of which more than 250 are known to be harmful, and at least 69 are known to cause cancer. Thirdhand smoke is generally considered to be residual nicotine and other chemicals left on a variety of indoor surfaces by tobacco smoke. Studies show that thirdhand smoke clings to a variety of surfaces long after smoking has stopped, and as the residue builds up on surfaces, it can begin to resist normal cleaning. These surfaces include clothing, hair, skin, walls, bedding, curtains, furniture, carpets, rugs, and more. This is important to note because it's these lingering chemicals and particles that directly expose babies, toddlers, children, and pets to the harmful materials in tobacco products. It's not known how long these compounds last, but it is known that they become more toxic over time. Babies, toddlers, and children are the most vulnerable to the toxic effects of the residue since they crawl around on rugs, fall asleep on carpets, and teethe on items like furniture. There is a direct correlation between homes where there are smokers and infant mortality due to the amount of toxicity to which the infant is exposed. There is also evidence that pets are negatively affected by thirdhand smoke, and their health should be taken into consideration when deciding to seek tobacco use treatment and recovery. Tobacco use is a major health concern facing our nation. It is the #1 preventable cause of death. That's where you come in. Prevention. Recovery from tobacco use is attainable, and working with your patients to help with tobacco recovery can assist in providing a healthier life for them.